All right, well, good afternoon. This is the City of Reading Board of Health meeting. It is Tuesday, April 2nd, 4 p.m. Thank you everyone for joining us today. I do not look like Dr. Dedhoff, if there's any confusion. He is out of town traveling, so I am Dr. Jessica Schwartz. I'm going to fill in for him today. So thank you again, everybody, for attending. We will call this to order as we do have a quorum of members. We do have a new member present, I believe, Mr. Moya. Hello, Mr. Moya. So, Mr. Moya, I'd like to take an opportunity just to have us introduce ourselves and have you introduce yourself as well and explain your background, if that's okay.
Okay. My name is Moya. I'm original from Cuba. You can notice my accent. I live in the city already 42 years. Okay. I retired from the district school. And I live in the south side all this year. I'm married, one child. Well, it's no child no more. One man living in another state, my son Michael. And I worked a couple of years in the older clinic. And I'm a 5'5", 75. So I decided this year to enjoy the more.
Great. Okay. Well, thank you for your interest. We're really excited to have you work with us. So if the rest of us could just introduce ourselves, I'll start. So I am Dr. Jessica Schwartz. I am an internal medicine doctor with Tower Health. I live in the city of Reading too. I've been on the board, I think maybe about 2.5 years now. And just again, really excited to be part of the group. So if people want to kind of go around and introduce themselves.
My name is Bob Hospodor, and I'm a city resident for 77 years. And I've been on the board for 10 years.
Okay. Thank you.
Dr. Paige Brookins. I'm the Director of Health Equity here in the city of Reading.
Great. Thank you.
You're muted, Kathy.
Kathy, yeah, I just sent you a thing to unmute.
Can you hear me?
Yes.
Now we can.
I'm Kathy Shorn. I've lived in my present place for 47 years. I went to nursing school at St. Joe's and worked there. And I thought being on the Board of Health would be very interesting, and it has been.
Great. Thank you.
My name is Jarrell. I work for the city of Reading, Lead Hazard Control. I'm the program manager. I lived in the city for all of my 27 years.
Okay.
Hi, I'm Charlie Reed. I am a supervisor with the property maintenance department and also supervise the city health inspectors. I've been doing that for 7 years, and I live in the city for the last 60 years.
Okay.
Jordan Henning, social worker at Berks Counseling Center. Lived in the city for about 8 years, but now I live outside the city. Yeah, that's it. Sorry.
That's great. Thank you.
Excuse me, James Stout. I'm the fire chief for the city of Reading. I've been a firefighter in Reading for 31 years. And I was born and raised in the city and went through Reading High and everything like that. Had Kathy's husband as my English teacher. And I'm currently live in the older township.
Great. Thank you.
I'm Mike Sninsky. I'm the EMS chief for the city of Reading under Chief Stout. I'm not a paramedic. I'm a pre-hospital registered nurse. Went to Pottsville Hospital School of Nursing. I was born at the old St. Joe's, and my mom went to nursing school at St. Joe's, graduating in '63. I've been in this position since the end of 2020, but I've been with the city since 2006.
Very good.
And Fred is the city solicitor. I'm not sure if he's able to unmute or not, but he's been in that position for some time as well, and serves as legal advisor to the board.
Hi, everybody.
Oh. Good.
I'm sorry, was there a question?
No, Fred, we were introducing ourselves to the new board member.
Okay, the long pause made me nervous.
No, no.
Good. Great. Well, I think we have everybody.
Yes.
Well, good. Well, again, thank you again, Mr. Moya, for joining us. And I think, again, just listening to everybody's background, I think we have a wonder group here. So thank you, everybody, for taking the time. And then, Shelley, do we have anybody registered for a public comment today?
We do not.
Okay, great. And then regarding the minutes from February 6th of 2024, can we have a motion and a second to approve the minutes, or if anyone has any comments to make an addendum?
I'll make a motion that we accept the minutes.
And I second.
Great. All right. Thank you so much. So to move on to some reports, health inspections. I know Mr. Charlie Reed is with us. So if we can, any updates you'd like to provide?
Yeah, we conducted 122 site visits since our last meeting. Most of those visits right now are trying to get things in order with the new system. Of those visits, we found 20 establishments that had expired ServSafe certificates and 26 establishments that had expired health permits with the city, which have since been rectified. And that's pretty much what I have for you today.
Okay, great. Any questions for Mr. Reed? No? Okay, great. Lead abatement, Mr. Melendez, any update?
Yeah, I'll give you an update of units. So for the Department of Health, I have completed 9 units. ARPA, I've completed, in progress, I have 3 units. And then the federal grant, we've completed 16 units, and then we have 12 more in various stages of the process. And we continue to get intakes weekly.
Very good. Okay. Can I ask like how long an average job, takes to complete, or?
So they have 10 to 14 days, the contractors.
Okay.
So once we relocate the tenants, they have that time period to get the work done.
Okay, very good. Any other questions? No. Okay. And then I know I heard Deputy Chief Siniski and Chief Stout in attendance, if you guys would like to provide some updates.
Thank you. I'll just keep it real brief. First, just wanted to extend a happy Doctor's Day to those in attendance.
Yeah.
And Michelle Smith was there for the CELG from Albright College. It's the Center for Excellence in Local Government. They did a study on EMS in Berks County and the crisis the EMS service is currently in. Obviously, things as rising costs, decreased reimbursement, all of those factors come into play. Reading Fire Department, we do approximately 19,000 calls for assistance every year. Our medic units, if everyone is fully complemented with 2 paramedics on each truck, we'd be roughly doing a medic for every 10,000 people for the city. We do a lot of different calls up to including a lot of social work type calls, as well as, the medical and trauma. Pretty much since EMS week happens, wanted to open it up if anyone is willing and able. You can always ride along with us as members of the health board, or if not, we can always set up the ambulance at City Hall, and everyone can just take a look, see what kind of medicines we carry, see what kind of equipment we have. More than happy to have any discussions anyone wants, and I'll put my email address in the comment box. With respect to the opiate overdoses, we're still kind of waiting on some information because there were some computer issues end of February into beginning of March. So we're still waiting on those stats, but as soon as I get them, I'll send them to Ms. Smith and we'll go from there.
Great. Great. Thank you.
Can I add one thing? The CELG dinner, oftentimes, as is customary in Berks County, when you're at a county event, there's a lot of looking down your nose at Reading. And at this one, we were pleased to hear that Reading is doing the best in the county with our EMS and fire service. So it was good to hear from county officials giving the city some very much deserved praise.
Yeah.
That's nice.
Yeah, no, I mean, kudos to your team. That's a tough job. And we need a lot more of you. So, I mean, that's saying something. Great. All right. And then, Chief Stout, anything?
No, just go with Chief Wiltsky's information that he passed on. He does a very good job of running the EMS department. I'm very proud of everything that he does, and I appreciate Charlie's comments. He did inform me about what went on at that dinner, and that was good to hear. And we appreciate the recognition.
Great. Awesome. Okay. Well, thank you. And moving on to the health literacy program. Sorry, Dr. Brookins, I know you were with us. I don't know if Caitlin Kammerer has joined us as well.
No, she wasn't able to join us tonight, but I have a report. So for in the month of March, well, let me go back. So last year we conducted focus groups, and one of the areas of our focus group was to collect information about health materials, specifically COVID-19 information. And we conducted 6 focus groups last year. This year, what we did with that data, once we compiled it, we created, and I don't know if you can see this, we created a booklet that was about health materials, one side being English, and then the other side being Spanish. So in the month of March, we conducted community feedback sessions based off of this particular booklet about health materials. The information was from like the CDC. We also worked with a local pharmacy to compile the information that's in this booklet. And now we are in the process of going through the data, making the necessary changes as we want to disperse this in the month of May. So that's what we're working on right now. We will be presenting at some national conferences, one in particular in May, the National Rural Health Association at the Health Equity Conference, on our work that we have done with the local health organizations in our community.
Very good. And where's the conference held?
That is in New Orleans.
Nice.
Wow.
Very good. Well, you guys have done some great work, so that's awesome. Very good. Good. And then just if there's any questions, but otherwise we'll move on to the old business, and I believe we have none in the parking lot there. So in terms of any new business, anything relevant to the group or the city that anybody would like to discuss?
Dr. Schwartz, what are the status of measles?
Luckily, in Berks County, we have been okay. The outbreaks that were happening were really centered in Philadelphia. So I can tell you, at least for Tower, and I would imagine for St. Joe's, all of our questions with intake now really pertain to measles and not, Ebola and COVID as much. So in terms of, we haven't seen the outbreaks in Berks County like we did in Philadelphia County.
Okay.
Yeah.
Thank you.
Yeah, sure. Any other business that anyone would like to discuss or bring forward? No. And actually, I just had a question for the group. If anybody else has been involved in any of the meetings or listened to any of the presentations from the Berks County commissioners regarding that survey that occurred in the county with the needs of the county and some of the recommendations, I wanted to see if anyone else was involved or heard of that.
Wasn't involved, no.
Okay. And
are you referring to the health needs assessment?
The Berks County Commissioners study that I think finished up last year, and they've presented it like twice.
Yeah. I mean, I read through it. I wasn't at any of their presentation meetings, but I know, because it was 3 parts, right? It was Penn State, Tower Health, and then the county did their own assessment, right? Yeah, okay. I'm just making sure I'm talking about the same document. Yeah, I read through it, but I haven't seen any type of discussion about the implementation of any planning or changes. And I know, selfishly, I kind of focused on the mental health aspect, that's what where I live. So, one of the things that was a little disconcerting was the Berks County provider to population rate, and it was only like 1 to 1,400 or 1 to 1,600. So yeah, so know, short answer.
Yep.
That, you know, but I would love to hear more about any type of changes that they're looking for.
Yeah, so it is an interesting assessment, and it is in the public domain, so that I still have it in my email. I could have that link sent out if anybody would be interested in to read it. But it was interesting because it did analyze percentage of primary care, percentage of dentists, percentage of mental health, like in Berks County compared to the state, compared to the whole country. And Berks County does fall short with all of those numbers compared to even the state of Pennsylvania. So we've actually used some of that data to try to argue, you know, some hiring on our staff. But what's also interesting is really one of the main recommendation is the creation of a board of health. So, but to your point, I've listened to both of their presentations where they've just presented it, but I don't see how they're going to action item it forward. And actually, one of the questions I had posed that nobody had answered was I brought up this board of health and just wondering how anything could interplay together, or they didn't even seem to acknowledge that Reading had this, you know, for the county of Berks. So I just didn't know if anybody else had kind of caught wind of anything.
No.
No. Okay. But if people would be interested, I'd be happy to have that link sent out with the minutes if people want to take a look at the data they collected and the next steps, which, like you said, to my knowledge, they don't really have action plans. Yeah.
Sorry, I was going to hold down the space, but you know, there is like, I think at the very end, there were some like recommendations besides that. But yeah, I mean, it's funny because I was just in a meeting with our CEO and the CEO, Dr. Joe Burley. He's the CEO of Bethany Children's Home, and he works with Alvernia and I'm blanking on it, the LGBT Center. And we were just talking about this like aspect of it, like the things that the county could do in regard to coordinating resources between all of the different providers and having streams of information, kind of like what Dr. Brookins is doing, like trying to streamline the health advocacy stuff. Like there's a lot of different ways that we would greatly benefit as a county and city from some of the streamlining of resources. And that would be the first step in doing that. So, yeah.
Yeah. So again, interesting assessment, but you know, I'll happily send that out, and maybe that's something we could, you know, revisit in the future. Because to your point, I didn't hear who was going to kind of take that next step, or even is that something our group would ever be interested in, sort of advocating, you know, what we've already been doing. And to your point, the people we've already connected with and know between the health systems and all the different groups, you know, what you need. It'd be interesting to see how we might fit in. So yeah, okay. Well, I just wanted to bring that up if anyone else was aware of that, but I'll send that out. Okay. Well, any other business for the good of the group? Michelle, is there anything else we're missing or anything else we need to review today?
No, nothing else that I have new.
Okay, great. Okay. Well, if there's nothing else, our next meeting is Tuesday, June 4th at 4 p.m. Again, via Zoom. And Michelle, would it be an option to be in person as well again?
Correct.
Okay, good. So we'll do these hybrid meetings. If anyone's around City Hall that can come in, that'd be great to meet some people. Yep. And again, if there's nothing else, can I ask for a motion and a second to adjourn the meeting?
So move for Brookins.
Second.
Okay, great. All right. Well, thank you everybody for joining today. I'll send out that link with the minutes, and perhaps we could have a discussion in June.
Nice to meet you all, people.
Nice
Nice to
meeting
meet
you.
you, Mr. Moore.
Have a good day, everybody.
All right.
You
Thank
too.
you guys. All right. Bye-bye.
Bye.